Hi, my name is Kayla Castellanos from St. John's Junior College. I am currently studying to be a nurse, and I have here with me today Mr. Jerome Flores, who is a 44-year-old patient with paralysis. How are you feeling today?
I'm feeling really good.
Okay, that's very good to hear. I spoke to you earlier about conducting an interview regarding your medical condition. I must say, I'm very happy to be here today talking to you and shedding light on this topic as it may be very helpful to others in a similar situation. Now, before we start, I want to tell you about some reasons as to why a person might become paralyzed. Um, for instance, a person may have a stroke, ingested some sort of toxin, or have a neurological disease. Other reasons might be due to a medical condition or traumatic injuries. Would you like to share with us your story about how you became paralyzed as it was due to an accident? Am I right?
Yes, sure. On March 7th, 2003, I was working as a linesman with my family business, private contractor for BDL. Um, that morning, I was working with my uncle and my brother. We were planting pole in the White Village, but something happened with the equipment, so we decided to climb the pole and put up the hardwares and what's that on the pole. So we were doing that from the morning after the truck start giving problem. We start doing that and we climbed up till midday. But from the morning until midday, I was sharing the rope that we used to pull up the hardwares and what's not with my brother. His rope we were using, and so we did that the whole morning, and then after that we went for lunch. And when we came back from lunch, we decided to use our own rope. But I was not checking my rope, or I didn't know that my rope was rotten. But my brother said to me that my rope is not good, but somehow I didn't hear that. And he started using his one. He climbed, I climbed. And when I was finished, what happened, the spur was hurting my leg, my foot, sorry, and the pain was unbearable. So when I finished dressing the pole, I put the rope over the arm and I tied to my belt, and I start lowering myself to ease so that I don't have to strike the pole going down. And upon putting my weight in the rope and it was rubbing on the arm up there, the rope burst. Immediately I got unconscious, thank God for that, and I fell on my back. And again, thank God I gained conscious again on the ground. Now I am there trying to get up, but something feels different. And what I did, I turned myself over on my belly because I landed on my back. I turned myself over on my belly, and then it's when I realized something was wrong. But upon me doing that, I think that was what caused my first um, major injury with my spine. So I think my uncle or my brother turned me over back on my back, and then I told them not to move it, but they were trying to call they called my parents. They tried calling Lomolus Hospital. That is a hospital right there next to us in Santa Elena, sorry. And they said they didn't have any ambulance, so my my brother and my uncle they tried to move me, but I was telling them not to touch me because I know that when someone gets in an injury like that, it's very dangerous. For you might be causing more problem when you're trying to help, but they were so scared probably, and they told us that no ambulance was nearby, so they decided to put me inside of the front of the pickup because the road was so bad that they didn't want to put me in the back of the pickup, so they put me in the front. But that again was another mistake that probably caused more problem to me, but I didn't worry about it because then they were trying to help me to get to the doctor. And we got in the pickup and we tried to get to the hospital as quick as possible. And we reached there. While they were taking me out of the front of the pickup, I was like sitting up and I felt a striking in my back. And after that, they put me in a wheelchair. And all this time now, I can't feel my lower body. So I think I knew I had a very severe injury. And they got me into the hospital and they put me on a table and after a little while, my parents got there and they said, I up to now I haven't really remembered what happened at that moment, but the doctor had pushed a big needle in my foot, but I did not react. But this is what my parents they were telling me. That's what I mean. So many things was going on at that moment in my head. I didn't even conscious what they did. So the doctor told them that I would be paralyzed for the rest of my life because of the severity of my injury. And after that, the same ambulance was actually in Spanish Lookout, but I don't know how the hospital did it now. And that same ambulance came to the Romulus Hospital, and that is where they brought me to this city. And when I reached there in the city, doctors at Healthcare Partners, they didn't have any specialists to deal with the severity of my injury. So at this time, my grandfather and my dad they start calling the doctors in Guatemala, and that's where they made arrangements for me to go there to do my surgery. And the following day, I flew on a bird plane to Guatemala and did a 5 hour operation where they slit my back open from the top all the way to the bottom, and they tied metal steel from the bottom. It's like the long nail. It started at the bottom and go all the way up right against the vertebrae and go all the way to the top and come right back down on the other side of the vertebrae. And they just tie it with wires and they sewed it back up. And that's how I am able to sit up right now.
I'm very sorry to hear that. So you mentioned it was with your spine. What part of your spine specifically was damaged?
T11, between T11 and T12.
Okay, so the T11 and T12 vertebrae are located in the lower thoracic spine, and they are crucial for supporting the weight of the upper body and are a critical part of the rib cage, which protects vital organs like your heart and your lungs. In other words, paralysis in your situation will involve the area of the lower part of the rib cage and the upper abdomen. So, how has your injury or condition affected your daily activities?
Um, it was a big change for me because um, I couldn't walk anymore. I can't walk anymore, and so I have to use a wheelchair to move around. Thank God I have a electric wheelchair that helps me to move around easily. But for getting me to get on the bed and off the bed, it's a struggle because I can't just get off the bed and walk off. I have to slide, like drag myself to the edge and then come off into the wheelchair. So that's a struggle for me. Um, Also, getting dressed is a struggle for me because I have to try put it on the bed or in a wheelchair. It's a little bit quicker in a wheelchair, but it's still a little struggling to do it. But over the years, I got better at it, so I could get dressed. So I guess just getting things that are high, like it's a little bit challenging for me. So sometimes I'll have to ask someone to help me if I can't reach something that is too high. So those are the few things that are really challenging for me.
So I know patients with injuries from T11 and T12 can experience severe back and leg pain along with numbness and weakness. Have you experienced those?
Yes, I have experienced back pain. It's something I have to deal with every day, but I've gotten used to it. I really can't feel below my leg because of where my injury is. So I don't really feel any pain below my waist. The only problem I have is nerve spasms, whereas my leg keep jumping. It can be three things. Um, if I have gas and it's not moving, my leg will jump. So I need to find some way to release the gas in my stomach depends on what I eat. That would cause the nerve spasm. Or if I need to urinate and it's not coming out, it shakes my foot also. And if I need to stool, then my foot would also warn me. So once that is happening, I need to try to get to the restroom as quick as possible.
Okay, so what are some ways you find relief if that pain gets too unbearable?
Well, to be honest, I'm not taking any meds at the moment, and I really haven't taken any much meds over the years because I'm not used to taking it. But the pain, thank God, the pain isn't as unbearable, you know, very painful that I need to take it. So it's not like that. It's not controllable, or it's not really hurting me as much, so I don't really want to take any meds for it.
Okay, well, aside from medication, there's actually many ways that relief can be provided. For example, there are electrical stimulation devices and physical therapy. With the electrical stimulation, a surgically implanted device can disrupt pain signals before they reach the brain. Another method involves electrodes on the skin that sends low electrical currents to block the signals, particularly the musculoskeletal pain. So another way is physical therapy, which is a method to strengthen the muscles and also help with a range of motions. Surgery may be necessary to remove these bone fragments or other objects that compresses the spine, which can prevent future pain. So, have you ever heard of any of these, or has your doctor discussed any of these with you?
They did mention about the therapy. I did it for a few years right after when the accident happened, but over the years I haven't done much of it. I tried to do a little by myself, um, in my room or on my bed, because it's very costly. To get it, I don't know why it's so expensive, but um, so I really don't go and take the therapy. I will do a little for myself, and that's how I have been managing it over the years.
Well, my final suggestion would have been spinal fusion, which would be required to stabilize the area. I know you mentioned before that you had that tied. So basically, inserting the metal plate would have immediate and long-term stability because the plate would have screws or rods to create a metallic construct that provides immediate structural support to the spine. This prevents excessive movements that put pressure on your back and protects it from further damage. The titanium material is highly compatible with the human body, so it's completely safe, meaning you might not have any immune responses or rejections to the foreign objects being placed at the spine. You said that your spine was tied with wire. Yes, so this would also benefit you as it allows you to carry some of the daily activities you did before the accident. What are some daily activities that you do?
Well, I have my own little business that I do. I'm carpenter, so I build furniture. Um, so I always have something to do, so I get up and I go and do that daily. And also sometimes I help out with the family business in the office, but mostly I do um, the carpentry work.
Okay. And how often do you change your position or relieve yourself from pressure?
At the beginning, when I just had the accident, I mostly slept on my back. For some reason, because of my lower body not being able to move, so I was pretty much always on my back. But over the years, for the past 5 to 10 years, I've found out that I turn a lot. I turn to my side, to my left side when I sleep, and then in the night I switch over to my right side. So I find out that it really helps me because I have gotten a little, uh, I don't know if it's an ulcer or if it's something I got, um, if I got hit or I rubbed it against something, but an ulcer was on my left leg that currently, thank God it's healing. But if I would lie too much on my left side and that I don't release the pressure, it breaks out. So I find out that I have to try and lie on my right side more. And when I do that, I see that it helps heal the ulcer on my left leg. So I really, in my sleep, it's just a natural thing. I just turn, I try to turn as much, and it's helping. So I know about the ulcer, so I try to do my best to prevent them from. from coming back.
I know that you're aware now that it's important for paralyzed individuals to change position. It prevents severe health complications, for instance, pressure injuries like bed sores, which you consider dental ulcers, those are bed sores, and blood clots. So, lying or sitting in one position for long periods of time puts continuous pressure on bony areas like your hips, heels, lower back, and elbows. I know you said you had them on your leg. Yes, so which compresses local blood vessels and leads to a lack of blood flow and tissue damage. Movement helps stimulate blood flow. Without it, blood can pool in the extremities, significantly increasing the risk of blood clots. And this is typically in your legs. So if a clot breaks free or bursts and travels to the lungs, heart, or brain, it can be very life-threatening. So it is advised that you change position every 2 hours to keep the blood flowing. So I know that you said you experienced those ulcers, but was it just your legs or was there more parts of your body that had them?
Um, while I was in Guatemala, somehow after the surgery, they did not move my leg. I don't know why they didn't put protection underneath to elevate my foot. But that was the first one that came. Right, the first one I saw was the ulcer on my back, the heel of my back of my foot because it was compressing on the bed and it was not moving. So but that one after that it got healed very well and it did not break up after that. The second one that created was after I met a friend that was in the same situation as me when I went visiting his house and talking to him. He was sharing about his life and he told me that he drove his car. So upon returning from talking to him, I decided to drive my pickup that my mom had just bought for me. Um, and when I go, for me to get into the pickup, I used to get in butt first, and it was hitting the little lever to push back the seat, but I was not. I can't feel my lower body, so I didn't knew at the moment that I was hitting it, and it created an ulcer under my leg, um, where I was sitting, and for years I struggled with it because of circulation. The blood, you could see the skin like it's like getting white. So from my experience of the amount of years dealing with it, once it's white like that, it doesn't heal well because there's not any blood there to create new skin or whatever, you know. Um, upon in 2012 when I amputated my left leg, after that the ulcer went away. It healed very well because then it didn't have the whole foot to deal with the circulation of the blood. So it was the blood just was focusing in that area and it got healed very well and I haven't had any problem with it anymore after that.
Okay, I'm sure that must have been very difficult for you. Well, let's stop right there, and I just want to know if you have any questions or concerns that you would like to share.
No,
Okay. Well, that should conclude it. Thank you so much, Mr. Flores, for doing this interview with me. It has been a pleasure talking to you about paralysis.
you're welcome. I have to have help.